everybody's seen that sometimes.
I'm like, I think so. So I called Medicare immediately and said, this was a male patient, not a female. And they took care of it with the guy and everything.
Yeah, I was asked to audit a bill, and it wasn't a Medicare situation, it was for a private insurance provider. And it was a set of twins, and they were both born prematurely. And one of the children was very, very sick, had a lot of difficulty. The other one, although it was premature, it was doing well. Well, that particular facility, every time they put a charge on the sick child, they also put it on the one that was not so sick. And I found, because those children were in the hospital for many months, I found $1 million in valid billing on that. Probably was not done intentionally. You know, somebody was cutting corners. Okay. Not everybody that a facility hires is going to do their best work. Nor will the facility know about it until something like that happens. But you know, that was just the one $1 million. So you need to look at those bills.
Often you don't get an itemized bill unless you ask for it from the facility, and I always tell everybody, even if you can't understand it, ask for the itemized bill, because if we all start doing that, red flags are going to go up. But
Well, and I've always done that because I've done auditing and so forth before, and they'll tell you, well, you won't understand it. Well, yeah, I will.
You know, Dr. Tucker, it's not even in the last year that a lot of the supplemental insurances, when you file a claim, are requiring that you send a copy of the billing. I've always asked for being in healthcare for so many years, that there's insurance companies where you have to send an itemized bill along with your claim form or they won't pay it.
Right.
So they're forcing people now to get those bills.
I think that'll
So,
help.
Yeah.
You know, if you know somebody's looking, you're just a little more careful. We all are.
Well, sure, sure.
There's a great story on 60 Minutes website right now about, it's a story that they did down in South Florida on Medicare, Medicaid fraud. And it was unbelievable. Some of the federal authorities there think that fraud to the taxpayers is probably bigger business than the drug trade is in South Florida right now. And you know, it's on the web. You can watch the video clip of it. It's very much worthwhile. So, or check your Medicaid card.
I want to ask a question. I hesitate to even bring this up, but if healthcare reform is repealed, Romney is talking about a block grant to finance Medicaid.
Oh, what?
Block grants? How would that work?
That's what I was talking about. Florida and Kansas are doing some pilot programs right now. And the benefits sometimes are different than traditional Medicaid. Okay. In Florida, one of the other things that they did was like a disease management component. You know, you're talking about people with diabetes being on renal failure. Sometimes having a case manager that is constantly doing teaching, reinforcing healthy choices for those patients will have a better outcome as far as being compliant, fewer complications due to their disease program. You know, there are a lot of things that you can do on the procurement side, like even on medical equipment, where you can save money, and it has not impacted patient care, but it's saved money so that you can pay for additional patient care if necessary. So those programs are really kind of exciting to me in that the outcomes have improved. not just reducing the cost, but the outcomes and improvement.
You know, it sounds like a no managed care.
You know, and there are aspects of managed care that are good. You know, particularly if you've got folks in there that will be doing instruction, you know, teaching people how to live healthier lives and make good choices.
Keep that nutrition.
Little stuff makes a big difference.
Yeah.
You know, even I have that, you know, an Advantage Healthcare, and they have case managers, and they literally have come out to the house and reviewed the entire medication list and, you know, all the kind of stuff, even into the supplemental drugs you take,
Right.
non-prescription. So I've seen that work in Advantage Plan.
You know, and there's sometimes over-the-counter stuff that people take that can create serious problems with some of the prescription medication or some of their health conditions that they have. And if you have a cold, some of the decongestants are not good for you to take if you have high blood pressure or take those medications. So, right, somebody that's looking at the big picture of what's going on. Our healthcare has gotten very fragmented right now, and there's not as much continuity. And I think those case managers provide the continuity that's missing in the picture. Any other questions?
That's great. Anybody else? Well, Stephanie, thank you so much for coming. Since Jonathan Stickland has not showed up, I guess that's the end of our program. Anybody have any questions? Well, thank you so much for coming. And for that, I need you to sign this form over here, saying you were here.
Did you say?
Not yet.
Kathy, I need you to sign too.
I was in the other class because that's where you usually go.
That's where I went to, don't feel bad.
Did you? And then I was thinking that,
Well, unfortunately, you still practice over
Yes,
here?
I do. I'm too old, but I still do.
What's your specialty?
Well, I do most of geriatric consultation, you know.
Then you're on my
In
sheet.
our culture, most geriatrics are on 15 to 19 medications. They usually have untoward blood reactions.
They do.
They're sent to report doctors, so
They're not needle or something.
Yeah.
I
And he said
go
you
into
are
the evaluation,
still on the state plan.
suggest nicely that maybe we need to reduce this, and this.
So are you going to nursing homes?
I go to 2 facilities. Now,
Well, I've got,
facilities.
I'm still,
Oh, you're all
I'm still old school.
Richland,
Where's
Mills.
your office?
Are you with?
It's not in American building, they're on
Just don't know.
An
Ours, back here is an office and a private entrance in my home.
Well, that's smart.
Yeah.
Yeah.
And I consulted for Catholic Charities and they helped with the program.
If you got anything, we've got to look at that.
Reading over my shoulder at Office Depot.
Well,
Oh, that's,
I was
you were
also,
just telling me about that.
Pretty guy.
she looked like a doctor. Just like, some camera
Now, my
back.
husband is, so I looked
She
up.
had a resume right there, and I said, she said,
Look
Dr.
at you, you got.
Ann Tucker, PhD, and I said, oh, okay.
You got some good
Dr.
genes.
Ann Tucker, introduced myself.
Yeah, I kind of set me back.
And I said, but I did, I admit it, I said, I cheated, I looked at your resume.
Because, you know, we were standing with you were faxing stuff too. I was fighting the Medicaid and I wanted to be sure that I'm really excited about coming down over the fall and getting Medicare and Medicaid. I try to see most of Medicare and Medicaid patients now because they get overlooked by good people. It's often,
You're gonna take that,
it
you
sounds
just take
terrible,
this
it's
too.
often people with high practice.
I think you might cut down where
It's
it's
often
all.
people that they can, the older person can understand what they're saying.
I might need a little bit to talk to some people, so that's why
it's not. But there will be.
Okay, so,
Yeah, I'll do
what time
everything I
will be a
can.
special
John.
meeting?
Good, I appreciate it.
I'll send you an email.
Sure.
I don't have a card. I don't advertise it for, I just